Your health matters and your voice deserves to be heard. Introducing the show that puts you at the center of the conversation. From common illnesses to complex conditions to the questions you've always wanted answered. Top medical experts.
The cost of maintaining that bed on a daily basis 24/7, because an ICU is a 24/7 unit. One single bed can cost between 2 million and 4 million per day.
Real questions from the viewers, practical answers you can trust. Now, join us every Wednesday at 10 a.m. as we talk openly about issues that affect you and your family. Health Q&A talk show, your health, your say. A very good morning to you who is still watching UBC TV. My name is Sophia Matavu, and it's the Health Q&A where we say your health, your say. It's always a pleasure for me to be here in studio with you every Wednesday at 10 a.m. and to be able to come and have your issues or your health matters addressed by experts on set. Now, today we are diving into a skin condition commonly known as acne. You know, we know there are pimples, but there is also acne, and certain times lots of young women are struggling with it and they just don't know how to go about it. Now, for many, it's more than just the pimples, like I said. It can impact confidence, self-esteem, and even mental well-being. I've seen lots of ladies running around left, right, and center. Then some will tell you, when I use this and it brightens the skin, it gets better. Then others will tell you now they struggle with the difference between brightening and lightening, and then you see somebody take on a different bleach altogether, but all in the name of trying to get rid of acne. So how do we know that this is what we are doing that is right? Now, with me in studio to discuss beyond pimples, understanding and treating acne effectively, is Diana Rose, a skin specialist with Derma Medicinal Herbs, who uses natural remedies. And I repeat, she uses natural remedies for skin treatment. Diana, a very good morning to you.
Good morning to you, my dear sister. Happy to be here, and I bless the name of the Lord. And whoever is watching this program, your lives will not remain the same and your skins won't remain the same.
There she says it, right? When she says that about the skin. Now, Diana, I'd like you to first help us by defining or helping us understand, because we confuse them. You'll find somebody doesn't identify that this is acne, and they're, you know, going down to actually press it with a lot of pressure, thinking that something will pop out, assuming it's a pimple. First, start with, what are pimples?
Yes, pimples, before we go to pimples, because of course acne is the wider thing that we're going to talk about, because acne is still a conditional, like skin, dermatological condition that affects most of our skins because of the clogged pores. At times even the hair follicles are damaged, because our skin is the widest part of the body, and it has a lot of importances, a lot of uses, and if there is anything wrong inside, we shall see you from the skin. So if like your colon is clogged, like we shall see it from the skin. So just like it is the skin that mirrors our inside. So if you see somebody, just like the word of God says that we shall see them from their fruits, but now if something is wrong inside, we shall see you from the skin. So about acne, there are even many types of acne. So acne usually affects like those areas which are usually produce oils on our bodies. Not every area on your skin produces oil. So there are always particular areas on your skin that produces oil, and the pores are usually affected. And there are those tiny hair follicles that you may not be able to see physically with your eyes, but when they get any damage, when they get clogged inside, so you see it manifesting later on. You may not see it immediately, but after you see it manifesting on your skin. So whatever results on your skin, there are many types of acne, as I've said. So there is that acne that affects teenagers, that acne vulgaris. It's different from what affects adults. Yes, so what affects the teenagers, like in your puberty, is different from what will affect you maybe when you're pregnant, you get it. So there are different types of acne that we are going to really elaborate more and more. Yes.
Okay, now that is quite interesting when you talk about the different types, because I'm hearing it for the first time. For us, once it is acne, it is acne. Why will it affect particular people and not affect others? Has that got to do also with my skin type?
Yeah, at times because of the family history, at times because that one can lead to you having a certain skin type of the same family, whereby you people, your skins are oily, they're conditional skins, combination skins, so dry skin. So there are many factors that really affects how you can even get acne, like how you can experience acne. So there are many factors that can lead you to have acne. Either you're a young child, just a teenager, or so as we're going to keep on elaborating how one gets it, what areas are most affected. So we are going to really go deeper into that as well.
Okay.
Yes.
Now let's get into how one gets it, because I believe on a daily you're seeing quite many clients.
Yes,
How
yes.
big is the problem of acne? Is it something that is so big that you really see it's affecting a lot of people?
Yes, it does, because at least in our lifetime, you have seen a pimple pop out of your skin.
Yes.
At least it is so rare that from your childhood to your adulthood, you've not seen something unfamiliar on your skin, especially like acne or pimples. So that's why we have to deal with them accordingly. So pimples are really far different from acne. The pimples is a symptom of acne. So acne is of different types. So there are those which are like papules, like swollen bits. You get it. There are those ones which are blackheads, what you call blackheads. Those ones are the ones whereby still the hair follicle is affected and it is clogged, but it is exposed to the air. That's why you see that dark opening there, which we call blackheads. Then the ones which are whiteheads, they're still swollen papules, like swollen things on the skin, but for them they are completely closed, whereby the pore is closed, so you cannot see anything, but something is embedded inside. So those are whiteheads. So that still falls in the category of acne. Yes, but for pimples, it's really far different. Because for the pimples, it is usually like a boil, like a small swelling, but usually at times it is in the contents inside, it has like some pus. There are those ones which are pus-filled, and those ones which are just filled with either dead cells or those dead hair follicles. Yeah, so they're quite different. So depending on what the person has experienced or what is on the skin is the way you treat it. So each one is treated differently.
Okay.
Yes.
Now, in terms of how we, the lay people, will treat them, first thing when I see a pimple on my face, my fingers just start itching to press
pop it out.
Now,
Yes.
then you find others, you can clearly identify and say this one has
Yes.
acne. But for them, the first thing is like, because we're all used to like, you press that pimple, we are treating acne the same way. Kindly guide us as the expert.
Yes. So whatever, before you even try to pop out anything, you have to understand the cause of your acne or the cause of your skin reaction. Let me say, what has popped out of your skin? Is it really just a mere pimple, a usual pimple? Don't just pop it out, because it can become something worse than what you thought. Because our fingers really carry microorganisms that can really affect those pores, because our skin, they're always open there. They can easily attract those microorganisms that can result into something big if you mismanage it.
Yeah, true.
So if you just pop something which has just come on your skin, sincerely, it might become worse, and you end up either going for a minor surgery because of something which was small. And it depends on the area which it has affected you, because they don't affect on all areas of our bodies. Okay, so we have those areas which are common or are prone to acne, pimples. The face, of course, the face has markings as well. The forehead, the nose, the chin, the cheeks. So depending where the pimple is, so you have to really take good care. Before others, they really need medical assistance, whereby say that these pimples are not the usual ones. All of a sudden, I've been with such a swelling on my skin, and it's been weeks, it's not decreasing, it's becoming either bigger, it is the same size all over for weeks. So accordingly, so you don't just tamper with a product without seeking better advice. Not everything that works for others will work for you.
True. Now, assuming, let's start with the acne for the young girls.
Yes.
And there are certain times it's like persistent. Now, as a young girls, this is the stage when we start feeling we are beautiful,
Yes.
we are this, the other, but the acne just won't go. And it is highly pronounced,
Yeah.
the cheek areas.
Yes.
That comes out. How do you deal, or how should they, young girl, manage and deal with that acne?
Yes, for those ones, like in puberty, let me say, in that stage,
Yes.
because the hormones are changing. So those, since there are types of acne, depending on the cause, you get it. So those ones which are the things that trigger or cause acne, okay? So those factors, let us deal with them now. So those ones which are hormonal, especially from those who are transitioning from childhood to puberty, because now the sweat glands are becoming more active, okay? So as a young adult, let me say that, as you're seeing your skin is, things are bumping and it is now becoming rough, things like that. So what you're supposed to do as even, let me say, because now it is concerning parents, because a teenager may not know what to use. And as a parent, you're seeing your child's skin is getting rougher and rougher, or pimples are popping out, let me say like that. So for that, what they should do is to manage even what they eat. First, that's number one. Manage what you put into your body. What you put into your body is what will display on the skin surface as well. So as a young adult, also as a teenager, the way you're supposed to look after your skin is very vital. If you eat oily things, if you just eat anyhow, as I told you that if your inside is not okay, we shall see from your skin.
Exactly.
So you have to manage, mind about what you put in your body, okay? And another thing, don't just use the products your mothers use.
That's a good one.
You said, hey, mommy's using this, let me also use this. Mommy, let me also apply this. So our skins are different. When you're a teenager, it's not the same as when you're
Much older.
mature, you get it? So a product for your mom might either be sensitive on your skin or might clog your pores, and then you start experiencing such. So not everybody anyway uses their parents' products, but you as a teenager, mind what you eat, what you put into your body, what you put on your skin. There are things that you can apply on your skin and they just clog it. So know the type of skin that you are dealing with, okay? So those ones which are hormonal, of course, there are people who give prescriptions for balancing hormones, you get it, because it is hormonal related, yes. And another thing, those for teenagers as well, you have to rehydrate. Teenagers, they don't want to drink water, you get it. Either it is dry season or rainy season, please rehydrate your body, rehydrate your system. It will help you to flush out, because our skin is part of the body that helps us to excrete toxins out of the body. So when the skin is not breathing, it will show us, okay? So let your skin breathe as you rehydrate yourself as well. So the products, as I've told you, that there are those that can clog your skin, so you have to be very mindful. And there are those teenagers who don't want to bathe, you don't want to wash your face very well, okay? So at times if you don't if you don't clean or you cleanse your skin very well, it can still clog your pores. If you don't exfoliate, like you open the pores oftenly, it can still, you can still experience acne or pimples on your skin.
Wow.
Yes.
Then what about, there are certain scenarios, we as the mothers have good intentions. You're looking at your teenager's skin break out with acne, and you go to whoever it is and you think that this product is good and it clears the skin without being mindful of the age. And you think, I have used it before, I should also give it to this teenager to use. What is your take on it?
I wouldn't advise such, but I've told you, like, since some acne, like it has been running in the family history, your mom at that particular age was experiencing the same and they used the product. But years have gone by, it may not be the same on your skin, okay? So most of the things that you should be mindful of, your diet really is very important, you get it. So those products that you just bump into, they have advertised this has worked for that, please don't just run into such products, because it will either worsen the skin or you may not see any difference, or it may not work for you at all. If it doesn't worsen it, it may not work for you. Okay, so to know something that is really working for you, even before you test it, that it will work for you, there's what we call a patch test. Like any product, it can be even those natural ingredients to see if it will work for your skin. There's what we call a patch test. You get that product, you can put it on part of your body, either like on the hand somewhere. Then you leave it for some time and you take it off and you see the reaction, okay? So there are those ones whereby you apply just on the wrist somewhere like that, and then after some minutes, you experience some irritation there. So just know it's not good for you. Okay, so there's always that test that you test before you put on your face directly. Not everything that they say this and that you just apply. No, you're supposed to do, let me say, a personal test. It's called a patch test. You test on your skin, the other part of the skin, not the face directly, because now you are catering for the skin. You first test it if it is good for you. Before you apply it, you can give it a day, apply just a few minutes or like 10 minutes, leave it there, then take it off, and you experience what the reaction it has caused on your skin. Okay.
Then we've had scenarios of some people say that you clearly visibly know they have acne. Now they use a product. The product will work for some months. Then after some months, they react to the product. What exactly is going on in the body?
There, as I've told you, there as we deal with factors that really cause, you might use the right product, but along the way, you do something which is not okay. So just as I've told you that there are many factors that really cause or that initiate, that really may trigger the acne that you have. So besides the hormonal and the diet, there are those, especially for teenagers, not only even teenagers, as for the areas that we usually experience acne, besides the face, the chest, the back, the shoulders, usually they affect those areas, I've told you. So as you use those products and you're not mindful of either your change in diet, you don't mind of how you exfoliate your skin, and you're not mindful of even that those who experience acne like on the chest, the back, you get it. So they put on tight clothings, you get it. They sweat in them and they don't even try to breathe. Let me say they don't leave the skin to breathe again. There are those, especially maybe for even teenagers who have like acne in the back, even adults. They usually put on backpacks like all the time, something so tight at the back, you get it. They can also experience the back acne. After there are those areas where the sweat glands are so active and something small can trigger or can make that outbreak, you get it. Besides the product, you can use the product and it works for you, but whereby when you have stress and anxiety, especially for women compared to men, yes, you can have a breakout. Yet the product might be good, but when you are stressed, there's a hormone called cortisol, which is the one that helps us to manage our stress in the body. When too much of it has been released, you'll experience the breakout, you get it. So it's the one that controls, it regulates. So there's a way God created our bodies in a way that it is complex, but there's that hormone that helps you to control your stress, because there may be factors around you, I've told you, but there's that hormone. If it is not balanced very well in your body, it can bring the outbreak, even though you use the right product on your body. So that cortisol is like, let me say, our traffic in Uganda. Like if it is managed very well, the flow is very okay. But if it is mismanaged, you'll see chaos. So that hormone, we should really know what our body is telling us, so that now, you know what, I have to handle this stress. That's why we can manage stress, I believe. No, there's no stress which is unmanageable. If we have God, we can manage our stresses as well.
Okay, Dada Rose, at this particular time we have our viewers coming in to participate on the show, and they have questions for you. One is asking, is acne classified as an infection or a condition?
It is it's a condition, because I've told you the pimples are the ones which like have infections in the pores. So acne, it is really general, as I've told you, if it is not managed well. So as I've told you, that those different kinds of acne that we've talked about. So if the pore has got an infection and there is pus in it, pus filled in it, or there is or it becomes bigger than what it was originally, and it becomes a cyst. You get it? There are those acne that can result into cysts as well. So as I've told, the different, even pimples, I've told you, they have types. So you can think it is acne, yet there are pimples which are infected.
Oh dear.
So there are those which are pus-filled, there are those ones which are just fluid-filled, there are those ones which are just filled with dead skin tissue, and they become something different. Like the one which originally started as a pimple, it has now resulted into a cyst, like a dermoid cyst or epidermal cyst, just because of that first layer of the skin is infected. So those ones which are infected are the ones which are pimples.
Okay. Then I would like to ask my technical team to kindly help us and display for the viewers what acne looks like, because there are lots of questions. What does it look like? They are finding pimples.
Yes.
We know that they come and go.
Yes.
Yeah. And then there are other times people have an issue and a concern of, you know, they remain with the spots
Yes.
despite treating the condition.
Yes.
The spots still remained mapped out, those
Yes,
black spots.
that's acne. But for a pimple, it just disappears after some, maybe few days or weeks. But if it persists, then that's acne.
Okay.
Yes. So, and acne is the one that will leave you with a scarring on your what? On your skin, as I've told you, different depending on where the site it is. So the acne will leave you with those scars, okay, if not treated well in the first place. So you can have a pimple, but you may not even, if you treat it right, you may not know where it was after some time.
Yeah,
but
true.
there are those people who have had pimples for weeks, and then at the end of it, you can say, this person has ever suffered with pimples, maybe some years ago, because it's now showing on the skin, depending on the way you managed it.
Okay.
Yes.
Now here we have, hello, my name is William. I've been struggling with acne for years now, using sulfur to treat it. It disappears always, then after 2-3 days after applying that, but later it comes back again. It affects mostly the back, under the biceps and the lower abdomen. I'm wondering, is this condition in the blood and needs medication? As for pimples, I avoid using smearing oils with mineral oil. Now I don't have them like before. So how should he deal with this condition of acne? Is sulfur one of the products meant to support and to treat?
Yes, people use products which have sulfur in them, because for them, like for sulfur, it helps to dry that tissue, because usually what is inside the pimple is either pus or like a fluid-filled sac, like pouch inside. So when they apply sulfur, it just helps to dry that particular pimple, let me say. But somebody to get rid of such, like for our dear brother who has mentioned, as I've told you, that if the cause, you've not dealt with the cause, you have used the product, but you've not dealt with the cause. How do you put on tight clothes? Like for the back, I've talked of backpacks, all the time, you put on backpacks. So cleaning your body is okay, washing your body very well, exfoliating is okay. At times, if you don't exfoliate, we shall show you how you can exfoliate your body in the natural way, using the natural products, which are homemade, let me say, homemade exfoliation, so that the skin breathes. And also, watch your diet. If your diet is not okay, you will not have a beautiful skin. Do you take plenty of water, or you're just on products? Are you rehydrating your body? So make sure that even though you use a product, you feed your body right. If you don't feed it right, the product will work shortly, and then it will be like a pattern, to go on and off, on and off, on and off. And at times, a product, when it gets used to the skin, it may no longer be active. Okay, yes, there are those products whereby I've used it for this for quite a few, quite weeks or months. It was effective, but now it's no longer effective, and though you use it for maybe some more months. So for such, still you have to know the cause of your acne. So as I've told you, that you have to know that I've used this one, but am I doing the right thing on my skin? Is there something I'm doing that is triggering it? Because there's something about, let me talk briefly about exfoliation. There are those people, they tell you use this scrub, you use this scrub, and then you start scrubbing your skin as if it's a carpet. You use you get, though it is rough, the skin is rough, but the way you the product that you put on your skin, as if you're taking. Let me be in the part of the skin. Let me talk on the part of the skin. You get like a brush. The product that you're going to use is like a brush on the skin. You scrub this side, you scrub everywhere. You don't know that what you're using on the skin, it is really rough, and it is going to create those tiny irritations that you may not see with your eyes, being prone to those microorganisms to enter, and then it meant to do you good, but now it is becoming reactive. So let us handle our skin with care as well. So our dear brother should manage, or to see if he's putting on tight clothes, the diet is okay, the backpacks, not everybody puts on backpacks, but there are those who do, okay? And if you cleanse yourself very well and you exfoliate, there are those products that we shall talk of that help to exfoliate or to open up your pores very well, to let the skin breathe. Yes.
Then is this possible? Somebody says, hello, thanks for the show. I live in Zimbabwe. I have acne since 2016. Can it last that long? I thought if somebody gets the right products, they're able to manage.
Yes, I've told you, acne it can become worse or severe. Let me say severe if it is mismanaged. If you don't use the right product on your skin, if you don't know how your body is responding to a product, you can spend with it years and years, 10+ years. Let me say that your skin is always like that, and you are comfortable with your acne. Let me say that. So if it is possible to retrieve your skin to become what you want it to be, in the right way or in the natural way. Manage what you've put inside, and your daily skin routine is also very important. There are those people, I don't think maybe you are a makeup person who doesn't know that my skin is oily, I shouldn't put on products which have gliss in them, which are glissy or oily in them. They'll keep on clogging your pores. They keep on clogging your pores. There are those ones who may try to make it disappear with either bleaching agents, and then because of the dark spots that they usually experience, so one might be led to brighten the skin somewhere somehow, or to lighten it somewhere somehow. But at the end of it, you are worsening your skin. You are worsening your skin. And I've told you there's a product that you can put on your skin, and the skin will show, you know what, you're just covering us. This is not okay for our skin. There was a time when I used the product on my skin. It had lemon in it. I started developing pimples where they were not supposed to be. You get it? And then I also went to another skin specialist by that time. Because I said that this product is supposed to work for me now. What is really, because I had done it, it was just a few, maybe say weeks I had used it. But when I realized that the skin was trying to vomit out what I had put. So there are people also who are suffering the same, that like maybe our dear sister who is experiencing acne for all that long, whereby you're just clogging all the time. Now the skin is trying to say, you know what, like to spill out, to spill out the toxins you have overput in that skin. So mind what you put there. Is it the same product? And are you still, you can use the same product having the same ingredients but different labels. You get it? You get it?
I do.
So let me say a product which is having either lemon, but this one is, but there's an ingredient which does not suit your skin. So yet you are putting more damage and more damage, or no change at all, because you have not gotten the right product. So it is very easy, or it is possible for you to get rid of your acne, which has spent years and years. If your inside has been cleansed, I believe even your outside will manifest on your skin.
Now then there is this one, I'll tell you for a fact.
Yes.
I believe even a person watching right now has experimented with this.
Yes.
And it's commonly done for pimples, but some people also use it on acne. Toothpaste.
Yes, toothpaste, yes, any toothpaste. It has ingredients or, it has ingredients in it that help to pull out or like to, they're like drying agents. So at times you can apply on a particular pimple because you're not going to apply it all over. So you apply particularly on a particular pimple, let me say that.
Pimple, not
it can help.
acne.
No, because this one, as long as there is pus in it, it is painful. You get it? The toothpaste will help you, okay? So, but if it is already there, it is weeks, it's already there, no work done there, okay? This one helps to, since it has, those toothpastes that have antibacterial properties, you get it? So when you apply, remember what causes pus on the, in that papule or the swollen duct or the swollen tissue there. It is a bacteria, you get it? So when you apply it, there's a way to help in one way or another. So if you apply it today, tomorrow, 4 or 5 days, it is still the same. My dear, it is something different. Yes, but I've also used toothpaste on my few pimples in case I get one, I can put. And it has worked for me. Yes. There are those pimples you can even get in the ears, so, which is a rare place, but because of either those let me say, the earbags that you can put or the headsets that you may put, those tiny ones, they can times create pimples down there, but there's no way you can put them, you're not even seeing there, you understand. You can put a little toothpaste there. It will dry within a few days. It will even increase the pain and everything. Afterwards, it will disappear. So even those few pimples, you can put, I advise.
Okay. Now you are supposed to help guide us on how to, did you say exfoliate the body?
Yes.
Yes. Kindly share that with the viewer watching you right now.
Yes. Exfoliating is a process of opening up your pores on the body. Okay. So when you exfoliate, that means you are removing dead cells or you are unclogging the blocked pore. So there are ways, people know scrubs, generally scrubs. It's the one that opens pores, but not everywhere that you're supposed to apply those scrubs, okay? So at times you can buy the ones on your, on market, let me say that. You put it on your face and then after a few days, you had a smoother skin, but after scrubbing, you get a breakout. And you wonder why. I try to open up my skin to beautify myself, but now this is happening to me. So exfoliating, you shouldn't even overdo it.
Okay.
When you overdo it, we have our natural oils on the body, on the skin, so on the skin. But if you over remove them, it will still damage our skin as well. So you can't exfoliate daily. No, it is not advisable. It is done, let me say, at least twice a week. Because we sweat, we eat, we put products, things like that, at least twice a week or once a week. But when it is daily, if it is daily, you are damaging your skin. And the things, let me say, the homemade exfoliating products that you can use is soda bicarbonate is readily available. It is not rough on your skin, it is really gentle on your skin. You can add in either coffee is still not rough on the skin. You can add in some cinnamon powder. There are those ones who add in like rice powder. It is still not rough. I'm talking of something gentle on the skin. When you look at those products, they are not rough. They are not like sugar. They're not like salt. Okay. If you just apply sugar direct on the skin, those granules a bit rough on the skin unless it's somehow dissolved. So I'm talking of those products which are gentle on the skin and they are beneficial. Okay, so you can mix your soda bicarbonate, you can add in coffee, you can add in coffee powder, you can add in your turmeric. Turmeric is very good for the skin, it's antibacterial and viral, it's really good on the skin, but you shouldn't put in too much. When you put a lot of it, you'll taint your skin instead. That's exactly what is happening to this one. So turmeric, a little bit of it, at least to help with the dark spots as well. Then you can mix in with aloe gel. Aloe gel is available even on market or the locally got from the plant itself. Or you can even add in yogurt, okay, just a little bit to make it smoother, because you're not going to get only the dry ingredients. You need to make a paste. And making a paste, you can either use water or yogurt, or at times people with oily skin, I don't advise to put milk. There are those ones who can make it paste but with milk. or honey. Honey is okay. You can use honey to make a paste. You rub gently your skin, especially the facial skin is really very, very sensitive. You shouldn't really be rough on it. However rough the skin might be, don't be rough on exfoliating it. After your gentle rubbing, gentle circular movements on the face, you can leave it on maybe like for around 10 minutes for it to dry. Of course it won't dry. There are those ones which may not dry on the skin. But after as you rinse off thoroughly, when you rinse and then leave some products there still, it might affect your skin. So you have to rinse thoroughly to make sure that because the other one, its use is to remove dirt, remove the dead cells, to open up pores. So if you don't remove those products you've used thoroughly, it will still clog the skin and still get the same effect of clogging the skin. Yet you meant to unclog, but now you are clogging it. So make sure you cleanse thoroughly after you have used those exfoliating products. Okay. What another thing that you can use on your skin, which is really very good, charcoal is good, but you have to make it fine. Okay, fine powder. Look at it, charcoal, the one that you usually cook with. It's good on the skin, but you have to sieve it so that it's really not rough on your skin. But all those products, you need to add a liquid, either water, aloe gel, honey, to make it up in paste form. Apply gently, then rinse off. Okay, so it is for the betterment of our skin.
Now, how can somebody who is struggling with acne in terms of treatment, because there are certain times some people believe that if not given a specific, whether some of them are given soaps, others are given some creams to use, how can they effectively manage acne? Because is it curable even?
Yes, it is.
Okay.
It is manageable. But as I've told you, if you know that this product is going to work for me, as I've told you, if you first do the test, the patch test, that now this is going to work for me. Besides the products, as before, let us go back just a little bit about the acne. There are those ones which are triggered by some drugs, maybe on some kind of medication, but all of a sudden something breaks out. So, and besides that, there are those ones who are expecting, you don't think you're going to be on any special medication because of your acne. You get it? So wait for that season to pass, your skin will go back to normal. You cannot fight those people when you are expecting, because those hormones have changed. If just know it's just for a while, your skin will go back to normal. There are those ones who experience like polycystic ovary syndrome. It's people who have maybe, they have that hormone in them. They usually experience the breakouts as well. There are those ones, so for people, anybody can really fight them off, can really treat them. First of all, your diet is really important. Rehydrating is important. The products that you put on your skin are important, okay? And as I've told you, depending on where it is, there are those ones who have it on their chest, but the skin, the face is very clear. You get it? So there are those acne, depending on the site they are. There are those ones that can, depending on the mapping, as I've told you, the facial mapping, there are those ones who have them like on the hairline, okay? It unaffected, just only the hairline. Know what caused it, okay? There are those people who have hair products which are not suitable for the skin. You get it? Because now the product also was able to touch your facial skin. Something breaks out, okay? There are those people have plaited, let me say, different hair pieces, and when they touch their hairline or their face, they got a breakout. Oh, so you also have to know the underlying cause, okay? So those people who experience acne like on the forehead, okay? So just sometimes it can be when you're stressed and then you get that breakout, okay? There's those ones on the nose because of more of the sweat glands. And there are those ones who experience acne on the cheeks. One of the causes are phones. Our phones are very dirty, whereby not everybody takes care about, like, to clean the phone. Our hands touch everywhere. Then you touch your phone all the time like this. So there are times that the acne that we get around the cheeks, those ones, most of them or some of them, they are because of what we put next to our phones can be a suspect. Okay, so mind your phone, the way you hold it, the way you handle it. There are those ones who sleep on pillows for months and months. So the shade of the skin that shades off in the night, there are those microorganisms that you will not see with your eyes, and they keep on entering our skin, entering to our pores, and then they damage. They cause acne, you get it. So mind also the hygiene in your bed, let me say your bed. Those who sleep on pillows, make sure you change your pillows oftenly, because there are those ones you may wash your face very well, use the right product, but there's something which you're putting on your body unknowingly, or which enters your body unknowingly, and at night, let me say at night, all day. But so pillows, they're also one of the suspects or culprits that can cause acne on our cheeks, okay? So phones is one of them. Make sure once in a while you clean you disinfect your phone, because our hands are always dirty. And I wouldn't advise so much to stay without cleaning your phone once in a while. You clean, because it also needs cleaning, so that you put it on your skin, and then, because most of the time all of us usually put a phone like this, especially those big phones. They're not like headsets or what. So when you experience people around this area, even the phone is a suspect, your pillow is a suspect, you get it. So there are those ones who experience acne around the chin area, because those are hormonal, maybe when you're into your P's, things like that. So don't be bothered so much. It's just for a while. It's just there for a while, and it will disappear after a few days. Okay, so depending on where it is. So just know that this is not a threat to me, okay? But if something persists, please, most of the cases you have to seek professional medical advice for the product to use.
Okay, now you have this person. I've been experiencing pimples in my parts for a year now. When they say parts, you get where they're saying.
Yes.
When I take medicines, they disappear, but now there is another one, not a pimple, and it is darkish in color. It itches so much. What should I do? Please, I don't have money to go to hospital now. Please, what should I do? I use cotrimazole candid powder to dust. They don't disappear anymore. It is persistent. I would say that Diana Rose will later, before she gets off the set, be able to share her contact and where you can find her, and she'll be able to guide you on what you can do about that. Okay, another one is sharing. Of course, others are sharing images. Then, hello, my face is darker than my other body parts. How can I handle that?
So let us first talk of that one who is saying that there's a pimple and something is a bit darker and itchy.
Yeah.
So at times when you mismanage pimples, they become something else. They can result into scarrings, and those scars, they result into keloids. Keloids are kinds of scars that become itchy. It begins as a small, tiny papule or a tiny swelling, maybe when the skin was opened, things like that, or there was something caused on the skin. And then they develop into a keloid. You may think it's because it might be in the same shape of your pimple, which was there originally, but now it is no longer a pimple, and it's there weeks, months, and years, okay? If it becomes itchy, it can be two things. It can be either a scar now, which is like developing into a keloid. A keloid is a scar that keeps on increasing over and over because of the cells that keep on multiplying abnormally, let me say, growing abnormally into that tissue. So if it is itchy, dark, so it can be either be a keloid trying to develop, okay? And if you don't treat it right, the truth is that keloids, they don't just stop on their way. They grow increasingly. They're not cancerous, but they grow, they keep on increasing in size. And another thing that you have to know, it may also be developing into epidermal cyst, like it's a small cyst, as a result of accumulation of those dead cells into the body. You shouldn't just pop it out, okay? Or you shouldn't just, any product that you may just use on it, it will not penetrate, it will not work for you. And if you just pop out and something comes out either like in brownish form, it can still be whitish form, yet it was not even painful, when all of it has not come out, let me say there's always a pouch, let me say a sac-like tissue inside there. If it doesn't come out, it will leave that opening whereby they keep on accumulating inside, and still another one will develop. So you have to we have to say exactly what that one is and how to manage it. It's not that you're going to swallow tablets and they disappear. And there are those areas that we were going to talk about, where, because all of it is skin, there are those areas which have hairs, okay? And if you don't clean them well, if you clean them in a wrong way, if you know, grooming yourself, you may develop pimples there, let me say, besides the laser bumps, let me say. Besides that, there are those ones, papules there, or swellings, or boils in those areas that grow hair, okay? If you don't manage it very well in the earlier stage, it can become something worse. Not a cancer, I'm not even going that side of cancer, not a cancerous tissue, but the areas that grow hair, remember that the hair can be growing and then you either cut it off in a wrong direction, then it curls inside, like it becomes ingrown, it starts to grow from inside. Then you see a swelling in those areas. First thing that you should know, if you start experiencing that, know the direction of your hairs. Know that's the direction you're supposed to remove it, okay? Don't just remove anyhow, like this zigzag. So you'll experience those swellings down there or even in the armpits because you're just cleaning yourself, okay? Yes. You're doing it in a wrong way. So do it in the right way. You may put an end to that, okay? And if abnormally you experience a swelling, especially for women, when during either those, before either your periods or after you experience some swellings there, okay, because of the heat, one thing that you should do, just know that it is trying, there's a follicle which has been damaged, okay? Either the body is trying to show that we want to put it, like, I want to come out, let me say. Don't just go down there and then squeeze it out, things like that. Don't press it out, no, it might become something painful or become bigger. So what you do, if either it is in the armpits or down there, get like warm compressions before, when you start experiencing it, because all the time you touch yourself. So you might know that something's not okay now, it's something which has grown maybe 2-3 days, you experience that. So just get a warm compression, just get a warm towel, not hot to burn you, because when you put it, because you want it to go for a few days because you have a match, no please, my dear. Get a warm compression, just press it, don't press to compress, okay? There's what we mean, compression is different, like pressing, okay? So just put it there for a few minutes, take it off, okay? Again, you do it. Within a few days, it will disappear on its own without even you taking any medicine, without you get it. There are those ones who put harsh products down there, because let us talk about it, because it is still part of the skin, and they get rashes down there. They're like pimples. People think that they are pimples. Those are not pimples down there, okay? Even in the armpits, those swellings or boils that you might experience there. So there are those people who, after they have cleaned themselves, they put products to smell good. I won't mention this and that, okay? The moment you do that, the hair is still, the skin is still sensitive. So when you put any product on that sensitive skin immediately after cleaning yourself, you know what I mean, I'm not going to mention this and that, it will clog it, it will irritate it. That's when you start getting swellings in the armpits, even down there, you get it. So, but when you experience that, make sure that when you clean yourself, at least if you clean in the night, at least spend some either 20 hours before you apply any either roll-on or deodorant or spray or perfume, whatever you want, before you put any product there, so that you may get rid of future boils, either in the armpits or down there, or future bumps on the skin, okay? So, and another thing that I want to talk about, like when after you have experienced that, only just use a warm compression. It will help get rid of it in a few hours. You may feel that relief and it will disappear. You don't need a doctor for that. Where there's no doctor, use that.
Then the person who still was asking about their darker face than the other body parts.
Yes. Our faces usually are subjected to sun, okay? Where do we cover ourselves? Because it is those white people usually use sunscreens. Sunscreens are very important on our skin, okay, to shield us from the direct UV rays which can damage our skins. So it might be because of the heat, okay. Yes, I won't say that maybe there's a particular product that darkened your skin, okay. I don't know if you had if it is darker, that means even the damage because of the sun, the heat can damage your skin like that. But there are natural things that you can use to shield your skin, okay. You can get or to help it brighten naturally, okay. Turmeric is one of them, but don't use a lot of it, okay. You can put turmeric, just a little bit of peach, either in a yogurt, apply on your skin to help it brighten naturally, okay. There are those who use banana peelings, bananas, okay. You can, that inner bit of it, you scrape it and then apply on your skin, okay. It will help. Even Irish potato, when you grate it, the fluid that comes, the water that comes, you can apply it on your skin. It is very good to help brighten naturally. Our tomatoes that we buy from the markets, just slice it, that liquid that comes out of it, you can grate, put on your skin. It will help balance your skin tone on the face. We are dealing with the face, the darker, the one who has.
I hope that whoever is saying was born like that, or maybe they have something that they use that darken the skin. You know, we like experimenting. When I look at your skin, I'm like, ooh, so, and then I also want to go and do the same.
Yes.
I'm asking you, what products do you use?
Yeah. So if it the darkness was as a result of a product, please stop that product, okay, and continue something very natural on the skin, okay. So if it's just because of the heat, I've told you the good sunscreens you can get so that you shield your skin from direct sun rays. And at times when it is too hot, please put on hats. They are not for travelers only. Is it? They're called adventurers. Those people who are traveling. Those visitors who come into tourists. It's not for tourists. Hats are not always for tourists only. Please, also you can put on a hat, a cape, so that you shield yourself, your skin, your face from the direct sun rays.
Okay, and then there's one who is asking, they have an oily skin. How can they stop it? By the time I think they're asking that, it must be way too much.
Oily skins, it's what God gave you, that's number one. It cannot just become oily because you ate too much oil. You get it? So after all, people have different types of skins. So how to manage your oily skin? Of course, you shouldn't add too much, or you shouldn't eat things still which are oily to add on more secretion of the oils onto your skin. But if you know originally you have an oily skin, the products that you can naturally you can use to manage, you cannot say that you can get rid of your oily skin, but how you can manage that oily skin. You can use there's what we call bento clay. It's available. Clay is good to reduce on the excess oil on the skin. Okay, so you can use it as a mask once in a while on your skin. It helps to help to pull out more of the excess skin from your body, from your skin. And soda bicarbonate is also very good to help with oily skin, to manage, not really to get rid, but to manage.
Okay.
Okay. Make sure the products that you use are not greasy or they're not oil-based, okay, that you put on your skin. There are those natural oils. Of course, coconut oil is good, but not it's usually good for sensitive skins, but the ones for oily skins, you're not going to go for those petroleum jellies all the time. They might add more of the oil on your skin. So use something gentle on your skin if it's already oily. At times, when you're bathing, you might use, steaming is okay, but doing it in the right way, okay?
Exactly.
When you do it the right way, don't overdo it, because when you over-remove the oils which are natural on your body, you are damaging it, okay? So you can use a damp, warm towel to clean your face. There are those who say that I don't bathe much, don't shower hot water. At least with the face, help it at least pass a warm towel to remove the excess oils. Because when you shower cold water, you have an oily skin. How will it, how will it melt off your skin when you put in cold water on an oily skin? So please, at least for the face, give it at least help it. Let me say, I'm talking on behalf of the skin, please. You can use a damp, warm towel. Just pass it. You may not need to pour all the time. At times, steaming is good, but do it regularly and regulate. When it is too much, you are affecting yourself. You get it. I remember those days of COVID. Eh? People steamed themselves. People came out with beautiful skins, but
and even the colors, some of the colors changed a bit.
Yes, so steaming is good, but do it regularly. It shouldn't be too hot to burn you, to damage your pores. Let it be minimal.
Okay.
Yes.
Then I would like to speak for the person who is struggling out there and they have acne scars. How can they be able to manage? Because there are times some people conceal them with makeup, so it becomes a bit of their part of their lifestyle to be able to gain the confidence.
Yes.
But if somebody's not comfortable with makeup and they want to be their natural selves, but they have the acne scars all spread out on their face,
Yes.
how should they manage?
For the scarrings, depending on where they are, it doesn't matter anyway. But those scars, you cannot just get a spot remover. Let me say, those spots, at times there are spots. You may not just go buy a spot remover, yet you've not dealt with the cause of your issue, okay? Has the acne completely faded out of your skin, or you still have bits which have acne, others there are spots, okay? Others have scars, so you cannot deal with the scars, the spots, when you have not dealt with the cause, which is the acne, okay? So if your skin has cleared completely and you've spent a while without experiencing any more pimples, no more acne, then you can deal with the spots or the scars in the natural way, okay? Turmeric is one of them, but after all, don't use too much of it, okay? Turmeric is one of the products that you can add on your daily facial routine, okay? With aloe vera gel, okay? You can also add coffee. Coffee is also good, that instant coffee. When you add, there's a way it helps to remove that tan, that dark tan, let me say that the darkness, or that whatever is causing the spots, whatever is causing the scars on your skin, whatever is as a result of the pimples that healed or the acne that cleared. So you have to use the natural products, the home, the ones in your kitchen, okay? You don't have to spend a lot on your skin. There are many expensive skin products which help, but at times not worth, okay? Yet you can do it in your kitchen, do it yourself, okay, DIY, and then you get a beauty. Though the natural things, if you are not patient, you might not see the benefits of it. All the natural things that I'm talking about, it needs your patience. If you want results in a few hours, you go to the pharmacy, okay? But if you want something, it takes time, but it is everlasting, let me say. Because the other, you can buy a cream, a few days, it has cleared. But after a few days, it is recurred. So things which are natural, it needs your patience as well. That's how you benefit, and the skin will also thank you for that.
Okay.
Yes, those natural products, the Irish potatoes are good, the tomatoes are good. People usually want to use lemon, but lemon, it may make your skin so sensitive to the sun, okay? So not everybody is really, especially those people who are have sensitive skins, so lemon may be eliminated. There are those who add lemon to help, because lemon has vitamin C, which is good to help to remove those dark patches or to get rid of the spots, okay? It's a natural bleaching agent in the lemons, but not to everybody, okay? Times you can apply just a little bit, maybe for a few minutes, then you take it off before it damages your skin.
Okay, and then you have this one. Nice program. We're enjoying the health Q&A. The skin specialist is really doing a good job demystifying skin issues. Maybe a concern is we are lacking guidance on the quantities, especially when she says don't over apply stuff on the body. And also when she was guiding specifically ladies when it comes to exfoliating, she needs to guide well processes, especially how time frames. We need some specific proof to guide on certain products also when they're using them. Otherwise, this is Vasajja Balaba Mugera, all the way from Kalangala district.
Yes, wow, good to hear from you from Kalangala. Yes, about the exfoliation or the quantities, depending on where the areas you're going to exfoliate, okay? Because if it's for the whole body, it's different. But now, though, we are targeting particular areas, the face, the chest, the back, those are the areas that we were dealing with most cases. So you may not have to mix a lot, okay? As I've told you, if you are to deal with the face, let me now specify, if it is the face alone, the quantities that you're going to mix at a particular time, or you might have your tin, let me say, put in your ingredients and you just scoop just a little bit and mix in water. That's different, okay? If for the face, you can use the product that may not even fill the whole palm. It can even fill just like a tablespoon. It can be a tablespoon when every product is in a tablespoon. And just put in either your water or your milk or your honey to make a paste, just that particular area. But if it is for the whole body, okay, if it is for the whole body, that means you have to mix larger quantities, okay? You have to mix larger quantities whereby you can keep on scooping just a little bit, you apply. If it is for the whole body, you want to exfoliate your whole body when you're going either through the sauna, let me say that, you can use like soda bicarbonate in large quantities, okay? When you're going there for the steam, you can scrub the whole body using those scrubbing gloves, things like that. For the face, it may not really help because we don't want to really damage our skin, especially the face. But other areas, the armpits, you can really do it your way, okay? But don't overdo it as if you're using a scrubbing brush.
Okay. Now, Diana, because we're going to have to cut this conversation here, but what is your take-home message for a person who is watching as far as acne is concerned? And then we'd also like you to share, a lot of people are asking for your contact on where they can find you to come and meet you in person and be able to interact with you to help guide them as far as acne is concerned.
Yes. All I can tell our viewers all over the globe that a beautiful skin is possible. And if you don't take care of it very well, you will have the worst nightmare of your life as well. So as long as you know what has caused that skin issue, please deal with it accordingly. If you can't, if you mishandle it, if you mismanage something which was simple, you have to deal with like a dermatologist, like a skin specialist to really help you with that. As I've told you, not every advertised product will work for you. Okay, so just know the kind of skin that you have, what caused your acne or your pimples, then you deal with it accordingly. So a beautiful skin is possible, but from inside and out. Yes.
Okay, and please share your contact. They have asked for your personal contact if you're willing to, because they would like to get in touch with you to help them manage their issues.
I work with Derma Medicinal Herbs for Dr. Sally, Professor Sally, the natural therapist. Okay, they're at Seroma Shoppers Plaza, behind former shop right now. It is called Clock Tower Mall. It is near Mega Standard. That's where we are. That's where you can find me. And my contact is 0782 73 1807, and another one is 0702 500 901. You can reach out to me, WhatsApp. I am really here to help each and everybody.
Okay, thank you so much, Diana, for your time.
Yes.
Well, at this particular time, I would like to tell you that acne is a skin condition, and once poorly managed, it will become something else. But you need a lot of patience to be able to deal with this. At this particular time, I'd like to hand you over to Parliament as the Natural Resources Committee is taking place right now. Thank you. Catch you next week, same time.
Electricity generation capacity grew to 2,098 megawatts, and the grid reliability now stands at 98%, with industrial electricity tariffs reduced to significantly improving Uganda's competitiveness as a manufacturing and investment destination. We continue to address the supply side constraints, working with UETCL and UEDCL. The second one is that